My name is Stephanie Rehm. I'm a full-time clinician at Novant Health in the oncology area. I am a board certified in neurology from the American Physical Therapy Association and also in geriatrics. And currently I'm working primarily with lymphedema patients, but also in our cancer oncology area. So today we're going to be looking at management of peripheral neuropathy and some other symptoms during your recovery. Chemotherapy is a prescribed first-line treatment for lung cancer, both non-small cell and small cell. And other treatments that you might be going through is also radiation, immunotherapy, and monoclonal antibody treatments. Fortunately, chemotherapy is very effective treatment, but unfortunately, there are some side effects. And one of the side effects is something called chemo-induced peripheral neuropathy, that's CIPN. It's thought to be caused by an inflammation of the peripheral nerves. Those are the nerves that come to your periphery, to your hands and feet. A lot of times the chemotherapy agents do affect these nerves, and primarily people describe it as like numbness or tingling, primarily in the hands and feet. And sometimes there can be some motor loss too, some weakness. So if you're experiencing things such as having difficulty opening medication bottles, managing buttons, that can be another due to the numbness or even the weakness. Or in your feet, it can be described as feeling, unsteady, particularly if you need to get up at night and you don't have a night light, because the sensory nerves are affected and not giving the full information to your brain. As I said, here are some of the symptoms, and they can also affect your balance. Other symptoms besides the peripheral nervous system, it can also affect your autonomic nervous system, which is involved in self-regulating. So some other symptoms, though a little bit rare, can be dry mouth, constipation, something called orthostatic hypotension, or when you get up, you feel dizzy, your blood pressure drops, a regular heart rate, and sometimes sexual dysfunction. Most of the symptoms from neuropathy that I see is more the sensory, so kind of the numbness and tingling, particularly in the hands and the feet. What causes some of the chemotherapy agents that cause these? I always say I divide them into two different areas. I have a lot of information here about some of the common medications that are suspects for inciting the CIPN, but I divide them into two things: the platins, the cisplatin, the carboplatin, and they can cause peripheral neuropathy because they increase the axonal hyperactivity, or the outgoing messages that our nerves give. They make them more hypersensitive and more active, and that's why we get the numbness and the tingling and the pain. The other generation of drugs that tend to cause neuropathy are the taxanes, and that's the docetaxel, the paclitaxel, anything with tax in it. And that also is thought to be caused by those nerves, those axons leaving the nerves, causing difficulty in transporting activity and also causing neuropathy. As I said, it's thought to occur because of inflammatory response that contributes to the pain and the numbness. Other conditions, some pre-existing conditions that can play a role in the neuropathy are if you have diabetes or peripheral vascular disease or your nutritional status. So some of the prevention strategies to neuropathy are some of the things that might help in preventing it are a dose delaying, so delaying some of your chemotherapy, a dose reduction, medication substitution. Sometimes they can substitute other medications. And then the last resort is stopping if there's poor toleration or functional impairments. If your balance is not as good or you're just having difficulty with your hands. I always say you want to talk with your care team about this, your medical oncologist, any kind of symptoms that you might be having. Talk to them about your concerns so this can be dealt with early. It has been shown that cryotherapy or cold temperatures during chemotherapy, particularly during with taxanes, can help. So sometimes like cold gloves or those cold caps can help decrease you getting the neuropathy when you're getting the chemotherapy agents. Certainly a healthy, balanced diet, certainly getting your enough fluid, 6 to 8 ounces of water a day. A balanced diet high in fiber has been shown to help with the neuropathy, and then really limiting your alcohol intake. That will definitely help decreasing your risk for neuropathy. Some of the medications that are known to minimize neuropathy symptoms, the one that's the gold standard, I heard you talk about the ASCO, or the American Society of Clinical Oncology. They have determined that gabapentin or duloxetine is the one medication that has been shown to decrease neuropathy. So that's kind of the gold standard. Some of the other medications that have been shown to help with decreasing neuropathy is something called pregabalin or Lyrica, Neurontin. And then some of the medications involved in some antidepressants, and anything that's amitriptyline, like Elavil or Cymbalta, sometimes that will help with the neuropathy, with decreasing the symptoms. Sometimes if people have a lot of symptoms, they are given opioids, and sometimes those have a lot of side effects to them. So it has been shown that things like Elavil or some of the antidepressants can help decrease the amount of opioids that you may need. Other things that seem to help are lidoderm or an analgesic patch, vitamins. You always want to talk with your care team about that, or compounding gels containing baclofen, mixture of baclofen, amitriptyline, and ketamine have been shown. Also, menthol, lotions with menthol in them can sometimes help with the symptoms. So we're going to talk about some of the treatments that we can do besides medicine for neuropathy. So one of the things is safety first. Welsher and Wood have shown that falls are among twice as often happen to people that have gone through cancer treatments as their cancer-free peers in the older population. So you want to safeguard against falls, and this can, take a couple years as the chemotherapy, as you're at higher risk as the chemotherapy gets out of your system. So the big things that I think of is they can cause problems, numbness in hands and feet problems, and problems with dexterity and balance. So you really want to think about as the chemotherapy leaves your body, and you want to really make yourself as safe as possible. And so that you may need to think about an assistive device, such as a cane or a walker, while you're recovering. The other thing that's out there that's pretty neat is those neat walking sticks, those hiking sticks. I just got back from Shenandoah National Park, and everybody's using hiking sticks. So if you don't want to use a cane or a walker, hiking stick is great because it helps give you that extra information that your feet or hands might not be giving you because of that numbness. That would be a good thing to have on hand to help keep you safe. You want to inspect the skin on your hands and feet regularly, okay? Because if it's numb and you might not be getting the information that you have a cut or something that needs to be addressed. You want to check that probably every night before you go to bed. Treatment, as I said, safety first. You want to make sure that you check your skin regularly. Use cold water before warm water. If you're, washing up, you may want to check the water with an elbow or have somebody else check it to make sure it's not too hot. With your hands, you want to use gloves. Padded pot holders, you want to take caution with sharp objects so you don't get a cut. With feet, you want to wear rubber-soled shoes to prevent slipping. You want to avoid uneven surfaces. Certainly use a nightlight at night, because if you're not getting the information, if your feet are numb, you're not getting full information. And at night when you get up, your vision's not as good as it is during the daytime. And so it will put you at higher risk for falls. And by all means, don't drive if you can't feel the brakes. Remember, this is temporary, and as the chemotherapy leaves your body, it should get better. Certainly, if you inspect your skin every night. If you have a cut or something, treat it with antibiotic ointment. If that cut gets warm, oozing, or doesn't heal, contact your doctor. They might put you on antibiotics for a while. So you want to really be safety first. You want to think about making your home as safe as possible. As I said, use a nightlight or a flashlight. Remove throw rugs that you can trip on. Declutter your house. Consider some handrails. And lower your water temperature and the water heater to help prevent burns. The other thing is there's some great home safety checklists, like the AARP has a lot of free resources online. So just use that to make your house as safe as possible as you're recovering. So we're going to talk about some self-management techniques. So first, just knowing that the CIPN, the neuropathy, will decrease over time as the chemotherapy leaves your body. With self-management, there's some things that you can do to help to manage your expectations of recovery. Remember, it's going to take time. So don't rush yourself. You want to set realistic goals. If you want to be able to go to a football game for your grandson, but you're not sure if you can, manage the bleachers, well, start with small, realistic goals of small walks during the day, and then gradually build up the walking. You might want to consider using a wheelchair to get there if you need to for the first game, but set those goals realistic and be gentle with yourself. Develop habits that reduce symptoms, getting a good night's sleep. Try to do things that you enjoy, avoid unhelpful thoughts. So think positively, listen to music if that helps, read a good book, and make sure that you keep well hydrated and inspect your skin. And develop an action plan to manage your symptoms, okay? And we'll talk about some of these things. Certainly good nutrition, getting good night's sleep, all those things can really help. Safety, you want to make sure you check your skin and protect your balance. That's number one while you're recovering. There are some things such as manual, I clump these as manual. Use of heat and cold. Cold early on can help prevent developing neuropathy symptoms, but it seems like the heat or some, general heat, some gentle heat can help with managing symptoms. Sometimes even wearing gloves if your hands hurt, even an isotoner glove or glove can help. That neutral warmth tends to help with the symptoms. You want to massage with cocoa butter, menthol-based creams tends to help. And then something called Olbas oil has been shown to help 2 times a day. TENS and acupuncture, and we'll talk about those in just a few minutes, and exercise. So these are things that you can use that are non-medicine that have been shown to help with neuropathy. Then the mental aspect of things, mindfulness, practice mindfulness, meditation. There are a lot of meditation apps that are out there that are really great to help with relaxation and helping to manage the symptoms and help with some of the pain management if it's painful. And guided imagery. There's some that has been shown to help with management of some of the symptoms, particularly pain. Diet, a high fiber diet and adequate hydration have been shown to really help with peripheral neuropathy. Sometimes there are nutritional things, and I will say up front, consult your health professional, your dietitian. We have a great dietitian with our local Piedmont Cancer Services. Julie Langford has a lot of things online. I am not a diet expert, but consult your health professional with any kind of supplements. But things that seem to help are B-complex vitamins, folic acid, vitamin D. We know vitamin D helps prevent falls, vitamin E, and fish oil. Magnesium or tonic water with quinine has shown to help with cramps. So if that's something that bothers you. And there is some evidence that a supplement called lion's mane, and I'm not even going to attempt to pronounce the mushroom that it comes from, can help with nerve pain. A lot of studies have been done more on diabetic neuropathy, but there is some evidence that it can help with other neuropathy. So really consult your dietitian or your oncology team if you want to try some of these supplements. Okay, we're going to go on to acupuncture. So this is non-medication-based treatments. So acupuncture is a 2,000-year-old treatment. It's from traditional Chinese medicine, and it's thought that it stimulates the qi, or the positive life energy that we have within us, to help our bodies balance out. With neuropathy in the Western medicine, it is shown that acupuncture, whether it's done manually with little needles or electroacupuncture with electricity with certain pulses, or auricular acupuncture, which is shown in this picture, that this helps that stimulates something called endorphins, or natural chemicals that are pain relieving, and that reduce the inflammation that we have that are causing the neuropathy, and also helps to release neurotransmitters, which would create a feeling of well-being and relaxation. And so there is some evidence that acupuncture helps. And in the 2015 ASCO guidelines, they examined 7 acupuncture studies, and it showed with people with CIPN, or neuropathy, chemoinduced neuropathy, and the symptoms were shown to alleviate symptoms of numbness. So they did a hard look at them, and there are some studies that show that it helps. There's another study in 2015 by Park that showed that electroacupuncture with patients treated with 8 cycles of chemotherapy had decrease in neuropathy symptoms. Acupuncture has been shown to decrease numbness, and because of that, it helps to improve walking. So there's a body of evidence that's growing for acupuncture. So if you have an integrative medicine portion of your oncology team ask to be seen for that, because that can really be helpful. If not, maybe your oncologist knows of a practitioner that's very knowledgeable that can do acupuncture. So I would encourage that. Another treatment that's kind of along the same vein is something called transelectrical nerve stimulation, or TENS. And this is done by an electrical impulse battery operated device that you can get online. Okay. And so it's thought to help with pain by two things. One is the electrical current stimulates these cells, the beta cells and the delta cells in our nervous system, that help to interrupt the transmission of pain impulses from the C pain fibers. So it's called the gate therapy. So it kind of shuts off those pain fibers and you don't feel them as much. Okay. That's the first mechanism it's thought to work. And the second is that the nerve stimulation releases those endorphins that I talked about before, which is the body's natural pain-killing chemical. And so TENS can help with that too. So the TENS is usually, as I said, it's a battery operated device that you can get online from anywhere from $31 to $300. If you're interested at the end, I can tell you which device we recommend. There, you can go online and look at the best rated devices and, the ones most highly rated. That's another ways to work. But usually the TENS unit has 2 channels. You'll see on your screen, there's 4 electrodes. So 2 of those electrodes belong to one channel and 2 of them belong to another. And usually the area of pain is right in between. So you can either put the electrodes kind of in parallel over the area of pain, or you can do it in an X, and with the area of pain in the middle of that X. So that's how you would do it. So one study, very recent, by Vujanovic on 2022, looked at 106 people with lung cancer with known chemo-induced peripheral neuropathy, and they did a 4-week trial of TENS once a day for 5 days for 30 minutes, and it demonstrated a reduction of pain by 38%. Okay, that's the recent study. A systematic review in 2020 by Ogle and Alexander said that there are few well-designed studies for an exact protocol. However, when looking into this, most of the studies show use of between 30 to 60 minutes of the TENS at least 5 days a week. And some of the parameters or for the settings for the TENS would be 100 to 200 pulse width, and then intensity of 40 to 80 hertz. That's how quickly, okay? And what I would recommend is usually there's a preset setting in the TENS unit. Is go ahead and use that preset setting, and you want to turn it up to where it's only a tingle. You don't want it beyond a tingle, but just a pleasant tingle, and then use that for 30 minutes and see how that feels. And then if that doesn't work, then you can, play around with those settings. But I would use the preset setting to start off with. The other thing, just with the TENS, even though it's available online, it's safe and easy to use at home, you always want to check your skin. Okay. You don't want to crank it up like a high radio that you want to listen, loudly to. You want to just to get that tingle, check your skin, make sure there's no irritation or something in the skin. The other thing is, as I said, it can be easy to use, purchase at home, and you can reuse the electrodes, just put them in a plastic bag, and then to preserve them so you can use them later. And then if they seem dry, you can put a little dab of water on them and swirl it over to make sure the electrodes conduct the electricity evenly. But that has been shown easy and effective. So we're going to go into exercise, and that's kind of one of my areas of interest. So exercise, there's actually level 2C evidence, which is very good evidence that it can be a neuroprotective effect against neuropathy. So neuroprotective, while you're going through chemotherapy, it can protect your nerves from further injury. And certainly afterwards, it can help with managing the symptoms and giving you a better quality of life. It's been shown that exercise intensities need to be moderate to high, should be moderate to high to reduce treatment symptom effects. However, this is usually tolerated a little bit better by younger people, but we know that biking and swimming can be tolerated by all individuals. So find something that you like to do and continue with it. So we know that the moderate aerobic exercise is anything that gets your heart rate up. So it could be walking fast, it could be getting on a stationary bike, it could be walking on a treadmill, anything like it could be dancing. That's all aerobics. You want it 3 times a week for 30 minutes for 8 to 12 weeks. And then moderate resistive exercise. So resistive exercise would be with weights. It could be with bands. It could be with your own body weight. like doing sit to stand with holding to light dumbbells or something like that. That would be more resistive exercises. But this is what's been recommended by the American College of Sports Medicine. So exercise and chemo-induced peripheral neuropathy, we know that closed chain exercises, meaning anything that's weight bearing, can be really helpful in reducing tingling and pain. So as I said, sit to stand, squats, even if you had one step that had handrails that you would step up and down that step, those are anything that's kind of weight bearing helps to reduce those tingling and pain. Balance exercises are very helpful. Interactive, the studies talk about interactive balance exercises. So it would be like a balance platform. If you're working with a therapist, you might have access to that, but otherwise you wouldn't necessarily. But certainly things like multi-directional stepping, varying your base of, a narrow basis of support versus heel to toe standing, those kind of things can be helpful. You always want to do balance exercise in a safe setting. So I always recommend, like in the corner of a room, if you have something in a corner that's unoccupied, and putting a chair in front of you so that if you get a little bit off balance while you're trying, you're going to lean into the wall and not fall, or, holding onto a countertop. Ankle exercises tend to be very helpful, like raising up on your tiptoes and pulling your toes up and balancing on a variety of surfaces. That tends to kind of challenge the system. Anytime you want to challenge a system, you want to do it safely. You don't want to put yourself at risk for falls. So think about it before you actually do it to make sure it's done in a safe manner. Moderate intensity, I always say walk and talk. So moderate intensity, you should be able to walk and talk and not be out of breath. So that's the intensity. Some of the hand exercises could be finger taps, thumb to each finger rolls. Sometimes there's a little putty that you can work with that can help strengthen, the finger. You can even cheaply get some Play-Doh and try to squish the Play-Doh, and that will be a little bit strengthening. I had a student recently, just for a couple of days, but he's from Elon University, which is close by here. And he and his group did a small sample size of virtual format, working with people recovering from lung cancer. And they looked at balance, and they looked at some of the things they saw, how well somebody could come sit to stand, do some walking, stand on one foot. And I asked him, I said, well, which exercises turned out to be the most helpful? And he said, based on this, and this is non-published, but it will eventually be published, exercises, those closed chain exercises like squats or sit to stand, something called a hip four-way, which is meaning you would hold onto a countertop and move your leg forward, out to the side, back, and then cross over your middle. Single leg stance. Okay. So holding onto a countertop. I always tell people, after you brush your teeth, try holding on to the sink and seeing how well you can stand on one foot over the other. Slow marching in place. So if you would hold on to that sink again and slowly try to lift one leg at a time, maybe to a count of 5 or something, that tends to help with balance and strength a little bit. And anything that's closed chain. So sit to stand, squats, those kind of things. Those seem to be the most beneficial for people for their balance. Most compliant exercises occur near the house with support from a family. The other program I wanted to highlight is something called the Livestrong program. The YMCA runs it, but it's for anybody that's gone through cancer. It's a wonderful program. My husband went through it, and I can't say enough good things about it. And you may want to ask for a physical therapy or occupational therapy referral if something's really bothering you. Okay. Get some individualized treatment. That sometimes helps. We're going to spend a few minutes on some other side effects, and I'm keeping an eye on the time. So this is lymphedema. So lymphedema is swelling. Okay. And it can quite often happen after cancer treatments. I usually think this is what I spend a lot of time on. I usually think of lymphedema usually post-radiation. Radiation tends to cause some swelling. A lot of our lymph systems in our skin. So anything that affects the skin, like radiation has to go through the skin, can slow down our lymphatic system and cause swelling. Certainly any kind of surgery if you've had surgical, surgery, that the scar tissue, because that's in the skin, can cause like little roadblocks to the lymphatic system, or anything like if you have a port, sometimes there's, that can cause a roadblock too. So some of the treatments that can cause lymphatic difficulty with swelling, and usually swelling is usually in a body part, whether you had surgery or radiation. A lot of times we think of it in the hands or the legs, but it can also happen in the chin area if you've, some swelling here also. Usually it can occur after treatment. A lot of times it occurs after radiation, and it can happen up to, usually if it's going to happen, it usually happens up to 2 years after your treatments. That's kind of the point that it's can be a problem. Some of the early symptoms of lymphedema would be swelling or heaviness or achiness in your arms or legs. Early on, you can dent your skin. It usually resolves. It's usually not painful. The skin is soft. Later, the swelling tends to stay. It doesn't resolve at night. It's something that we call, it's not reversible. Sometimes the skin gets thicker. We call it hyperkeratosis. It's kind of thick. Sometimes it get little bumps on it. And one of the things, a lot of people are like, well, what if I don't treat lymphedema? One of the things that it does is it makes the lymph heavy, of course, but it makes it more susceptible to infection. So you do want to get treated. It usually is easier to treat early on than if you wait, So talk to your physician. If you're concerned about having some swelling that's just not resolving, and they can get you referred to a lymphedema therapist. So how do you manage lymphedema? You protect the skin against scratches, cuts, and burns. The lymph system helps to get rid of bacteria and viruses. So you want to make sure that you keep the skin intact. You want to use a good moisturizer, low in pH. Sometimes that can be like, we recommend Eucerin or CeraVe, something like that. You want to avoid anything that's tight, jewelry or shoes or socks. You want to elevate the limb to help let gravity be your friend and help it resolve. Avoid salty foods. Gentle exercise tends to help. The muscles will help move the fluid out. So we usually recommend gentle exercise from head to toe, plus deep breathing. And sometimes a gentle massage. Remember, the lymph system lives in our skin. So, a gentle massage. So really kind of massaging the skin, working from the distant fingertips towards the palm or the distant toes upward towards the center of your body. And then some compression garments. I have some ones that are one of my patients. These are a little bit more designed from a physical therapist or occupational therapist, a lymphedema therapist. But you can use some over-the-counter compression if you have swelling in your feet, can help, but they need to fit you. Usually you measure around the ankle and the calf, and then you look at the box. And then if you fit in between, you need to fit in between the parameters that the box tells you. Because sometimes if you get something that's poorly fitted, it's even worse than not wearing anything at all. If you're concerned about swelling, if it's out of the ordinary, ask your doctor about being referred to a lymphedema therapist, and they can help you with that. The last topic I'm going to talk about is scar tissue. So scar tissue is a normal part of healing over a surgical site or around a port. Our body scars to help heal it and to make the skin strong again. It lays down a lot of collagen, which is a very dense tissue, which is not really movable. And so, but it does that normally to help heal itself. But one of the things with collagen is that it can be very non-pliable, and certainly if it's over a joint surface, it can sometimes restrict the range of motion, and sometimes scars can be a little bit painful too. So, and scar formation continues anywhere from 6 to 24 months, after your surgery. So it takes a while for that scar to get, back to, normal, as flexible or pliable as it's going to get. So it takes time. So sometimes some of the treatments, the surgical treatments, those kind of things can make you more susceptible for scar, having difficulty with scar tissue. And sometimes if the scar tissue, as I said, it can limit your range of motion. It sometimes can be painful. It certainly feels tight. So, sometimes we do need to treat the scars so you get full motion and not painful. So some of the treatments we know that can be helpful for scar tissues, there's something called ScarAway. It's a silicone gel. And Wang in 2020 looked at randomized control studies looking at comparing scar with people using the silicone gel post-op, and showed that using this ScarAway post-op can help reduce the scar height, pigmentation, and help with pliability. So right after surgery, even within, as I said, the scars takes sometimes up to 2 years to fully heal. So you could even try this a little bit later on. It might help. Scar massage. So scar massage is well known. You want to do it twice a day for at least 5 minutes. And when we do a scar massage, you want to take little circular motions over the scar area and around the scar. You don't want to use lotion at that time because you don't want to slide over the scar. You want to really move the skin. And if it's tight in one direction, you kind of hold it or massage a little bit more in the direction of tightness. But that has been shown to help with increase movability and also decreasing pain. Sometimes exercises, stretching the affected areas can help. So certain specific exercises can help. And if some of these things don't seem to help with the scar massage, you can ask to be referred once again to physical therapy or lymphedema therapy that can help with the scar management. Some of the other techniques that sometimes we use are soft tissue techniques like cupping. That lift the tissues up to help with it, moving the scar. Sometimes we use a kinesio tape, which is a certain kind of tape that helps to kind of lift the skin up and help with the movement. Sometimes some compression garments or orthotics, and sometimes even dry needling has helped with scars. So that is all of my talk. I'm a big junkie on research, so I have about 3 pages of research for this.